viewers, welcome to DDM Health News Update. Under the program, Your Health, Your Wealth. The Economic Community of West African States, ECOWAS, through its specialized health agency, the West African Health Organization, WHO, is urging researchers, policymakers, healthcare professionals, and stakeholders to intensify efforts in fortifying regional health security against Lassa fever and other emerging infectious diseases. This call to action was made in a statement released on Friday as WHO announced the second Lassa fever international conference scheduled for September 2025 in Côte d'Ivoire. With a theme, Beyond Borders, strengthening regional cooperation to combat Lassa fever and emerging infectious diseases. The conference seeks to drive sustainable preparedness strategies and enhance regional coordination. Discussions will focus on advancing research and development, improving outbreak response mechanisms, and fostering cross-sectoral collaboration, all essential components in the fight against the deadly viral hemorrhagic illness. Lassa fever remains endemic in West Africa, with Nigeria, Liberia, Sierra Leone, and Guinea being among the most affected nations. The disease continues to expose critical weaknesses in the region's health systems. In 2025 alone, Nigerian Center for Disease Control and Prevention, NCDC, has confirmed 506 cases from a total of 2,492 suspected cases, with 95 deaths recorded so far. Despite being designated as a priority disease by the World Health Organization, Lassa fever outbreaks follow a recurring pattern of containment followed by resurgence, highlighting the urgent need for a sustainable research-driven and well-coordinated response. WHO emphasized that no single country can effectively combat Lassa fever in isolation. Globalization, increased travel, and frequent cross-border movement have exacerbated the spread of infectious diseases, making regional collaboration and information sharing indispensable in mitigating public health threats. Building on the foundation laid during the inaugural 2019 Lassa fever conference hosted by NCDC in Abuja, Nigeria, the 2025 edition will convene leading policymakers, scientists, healthcare professionals, and key stakeholders to foster regional coordination and strengthen collaborative efforts, share scientific advancements, including promising Lassa fever vaccine candidates currently in clinical trials, explore financing mechanisms for epidemic preparedness and response, dive into operational research on surveillance, outbreak management, and environmental factors influencing disease spread. According to WHO's Director General, Dr. Michael Assey, Lassa fever possesses a persistent and escalating threat to lives, public health, and regional economies. The disease causes between 100,000 to 300,000 infections annually, with an estimated 5,000 deaths. Emerging predictions warn that climate change could place up to 600 million people at risk of contracting Lassa fever, underscoring the urgency of robust preventive measures. Dr. Catherine Ramsey, Lassa disease program led at the Coalition for Epidemic Preparedness Innovations, highlighted the significant strides made in recent years in the fight against Lassa fever. She emphasized that the 2025 conference will serve as a critical platform for global health experts to assess progresses, identify research gaps, and shape a strategic agenda for future outbreak responses, particularly as climate change and population growth in the region continue to drive larger and more frequent outbreaks. The WHO featured multifaceted approach to tackling Lassa fever, which includes plenary discussions with regional and international health leaders on financing and cross-border coordination, panel sections exploring vaccine research, community surveillance, and outbreak preparedness, parallel sections offering in-depth analysis of operational research, and environmental influences. Well, with a growing sense of urgency, the second Lassa Fever International Conference is poised to be a pivotal moment in reshaping West Africa's response to infectious diseases. WHO remains steadfast in its commitment to driving collective actions, ensuring that research, policy, and practice coverage to build a more resilient health system for the region.
As cases rise, medical teams are mobilizing to provide urgent care and containment strategies. Lassa fever has emerged as a significant public health threat in North Nigeria, raising alarms among healthcare professionals and communities alike. Public awareness campaigns are being launched to educate communities about prevention and symptoms of Lassa fever. With increased surveillance and testing, authorities aim to identify and isolate cases swiftly to prevent further transmission. Collaborative efforts between local and international organizations are essential in tackling the outbreak effectively. Despite the challenges, hope persists as communities unite to support one another and combat the spread of Lassa fever. Innovative treatments and research initiatives are underway to develop effective vaccines and therapies against Lassa fever. The resilience of healthcare workers shines through as they continue to put their lives on the line to care for those affected. As the situation evolves, ongoing data collection and research are crucial to understand the outbreak's dynamics better. Community engagement remains vital, with leaders encouraging healthy practices to mitigate the risk of infection.
Well, viewers, this is all we have for you for today. Stay tuned as we bring you further updates on these crucial events and its impact on global health security. Well, don't forget to like, share, comment, and subscribe to our YouTube channel, Dasra Digital Media, for more news updates. Until next time, I remain Nenyo Michael in his name. Bye for now.